Hey, it's Noel Williams with Optimal Health Associates. I'm going to give a talk about something that may seem odd for a gynecologist, but it's not for me. It's hypogonadism or male hormone replacement therapy. I have a couple thousand men I take care of. A lot of them I call my husbands because it's the husbands of my patients. I started taking care of men about 10, 12 years ago. At first, many years ago, I would refer them to some other doctors, but a lot of those guys retired and someone had to take care of male hormones. And since I'd been taking care of women's hormones for so long, I started learning about male hormones, which actually turned out to be pretty easy compared to girls' hormones. So I have learned how to do it and I'm actually an expert on it now. So male hormones is referred to as hypogonadism or low testicular function. But I think more importantly, what happens with men is men, like women, start to feel different and they feel tired, worn out, lose concentration, gain weight, low libido, loss of erectile function, and they need someone to help them. And there's a big change that happens to men. And the unfortunate part is a lot of times when guys go in and want to talk to their physician about something that's a little more intimate, what happens as a guy when you talk to your physician, and especially when you talk to a male physician, unfortunately, is you go in and say, "Hey, Dr. Jones, how are you? I'm in today." And Dr. Jones goes, "Tom, how you doing, Tom? You doing okay?" And you're like, "Well, yeah, I'm good." And "You're fine, aren't you, Tom? You're doing good," because you get this whole male bonding talk going. And there's never that opportunity as a man to say, "Well, I actually don't feel so good," or "I'm feeling sad," or "I'm having a little problem with erectile function," or "I'm having some issues that are pretty personal and I want to bring up." And that's one of the benefits I think that I have had with talking to men and our practice has had is we talk about intimate things with people all day long. So it's been a natural outgrowth for us to be able to bring men to the table and help them talk about things that are very personal and get them to communicate about stuff. So hypogonadism or fatigue is something that happens when testosterone falls or thyroid falls. And what has occurred, it turns out, is globally, testosterone levels have fallen. There's been some really cool studies that have been done where we look at the average level of testosterone now in 35-year-olds has fallen 50% from 1985 to 2015. There's some different theories as to why, which I'm not going to go into right now, but this is very clearly established. And likewise, sperm counts have fallen 50% over the last 30 years too. And the outgrowth of having these lower levels of testosterone is you don't feel as good. You're tired, you're worn out, you gain weight, sex drive changes, you don't feel well. So our approach is to work these things up and find out why someone doesn't feel well, of course. A lot of times it's testosterone, but a lot of times it's not too. And that's one of the things that separates us when we're approaching it is we always start with someone's having symptoms and we figure out why they're having their symptoms to make sure we have it correct, or we see all the different causes as to why someone doesn't feel well and we correct all of them, not just some of them. And so that way we get it fixed. There's often concerns about adding testosterone back to men because we have to be careful in terms of, does a guy want to still have children? Does a guy not want to have children? Because there's different approaches to different scenarios. If you have someone who still wants to have children, we don't want to add testosterone back. We have to stimulate the testicle. If a guy doesn't want to have children, we want to add the testosterone back. And there's different ways of doing that. I mean, there's creams, there's shots, there's pellets. And so we have to select the right mechanism for each person. The concept, though, to be very clear on, is testosterone add-back therapy is incredibly safe for men. There was one study in the Journal of the American Medical Association that potentially showed harm, but it turned out that study was done incorrectly. More than 35 Mainstream medical organizations or societies have asked it to be retracted. The problem with that study was it showed an elevation in risk for cardiovascular events with add-back testosterone, but the problem with the study was they reversed the numerator and denominator in the study, so it actually, when it was reanalyzed, the men on testosterone had half the risk of cardiovascular events, but the authors won't retract it, and JAMA won't retract the study, even though everyone knows it was done incorrectly. There's been multiple other studies now that have come out that have shown between a 50 and 65% reduction in men who go on testosterone for the most part. So we know testosterone is very good for cardiovascular disease prevention in men. It does all kinds of other things in men, from weight loss to lowering the risk for diabetes, to lowering insulin sensitivity, to a myriad of things. So add-back testosterone therapy for men is very, very safe and very, very effective, which is the take-home message in what I'm trying to communicate today. But it's always within a complete plan for men to get their health organized and to have them learn that good medical care involves a complete plan for their health. And it's not just, oh, we're going to give you a ton of testosterone, see what happens, and voila. It's have it organized, let's do it correctly, let's monitor you with the testosterone, because testosterone isn't completely, oh, here's a shot, see you later. We have to monitor your estrogen levels to make sure they don't go up. We have to monitor certain laboratory parameters. We have to monitor your PSA and your prostate and things. And so all very straightforward stuff, but we have to do it correctly. So that's just a summary for guys to know that, yes, testosterone is one part of the puzzle if you're tired or not feeling well, and it's something we do all the time, and we can help you with that. So I hope that helps some with understanding on testosterone and hypogonadism in men. Thanks very much.